welcome to Eugene's Speech Therapy. I am Sierra. I got a question on my YouTube channel, and it was from Brianna Kite, asking about retraining the brain for the mouth muscles in order to be able to speak. So this is a problem that a lot of people have. Something happens and they are no longer able to speak. Now, I don't know what the problem is. I don't know why you lost the ability to speak. I'm not sure if you had a brain injury or something else. So the suggestions would greatly depend on what the problem actually is. So is there an anatomical problem? Was something removed from your mouth? But let's just say that it's some sort of neurological problem. This can happen after a lot of things: stroke, brain injury, disease. And there are different causes of this. So one is aphasia, where you know what you want to say but the words aren't coming out. There's dysarthria, which is a physical problem, meaning, again, you know what you want to say but you physically can't move your mouth to do it the way that you want to. There's apraxia, which is a motor planning problem, where you try and talk, but as the information on what you want to say comes down to the physical part, it gets kind of scrambled and the words don't come out right. So depending on what the problem is, the therapy is going to look a lot different. So for people with aphasia, you do language therapy. For people with apraxia, you again do language therapy in a very systematic way in terms of getting out a little bit at a time and then growing on that. With dysarthria, the weakness, which I think maybe is what you're talking about, you can strengthen up the muscles to make them work again. You can certainly do that. It's usually best to make it functional. So working on sounds and words and phrases you're actually going to use in your real life. Now, that doesn't always do it. Sometimes we still can't communicate the way that we want to. And that's when we go to alternative or augmentative communication, AAC. AAC is an aid to helping you to communicate. So this can be high-tech or low-tech. Low-tech is writing down what you want to say or texting it into a computer that makes it talk for you. You can have a high-tech device that's all programmed just for you, and you push different buttons and it speaks so people know what you're trying to say. You can have a communication book, you can have pictures, text, basically anything that allows you to express to other people what you want without using your actual voice or speech. That can be really helpful. So I do suggest that you see a speech therapist if you're struggling with this, because they're going to be able to assess you, to diagnose exactly what it is that's going on. I can't do that based on a few sentences. So speech therapists, that's our number one job. So I highly suggest you reach out to someone. Please ask more questions if you need to. I put out a weekly video on speech therapy topics. Thank you very much.